Well, hello everyone, good afternoon. A warm welcome to our third Expand webinar. Thank you for joining us in this third webinar in this engaging series dedicated to the latest developments in the European Electronic Health Record Exchange format. This quarterly webinar series is focused on the topic of interoperability, the European Health Data Space Regulation, and how common UA framework will allow the use of health data across the Union for research, innovation, public health, policy making, regulatory activities, and personalized medicine, known as the second pillar of data used on the EHDS. During this webinar, we'll navigate this landscape, exploring the interoperability challenges and their role within the European Health Data Space Framework with insights of our distinguished speakers. And I hope this is not just a discussion, but a collective engagement of all of us to shape the future of the healthcare data in Europe. So I think I can tell you before we dive into our webinar, I just wanted to share with you a few essential details with you. Today's events will last approximately 1 hour, packed with valuable insights. And please note that these webinars are recorded on Zoom and will be made available or as a recordings afterward. This means that today's session will serve as a lasting resource for anyone seeking to stay informed about these latest developments on the format of European data exchange format. So we have to assure that all of us have the opportunity to revisit this content of share with our colleagues and our peers. So let me just tell you that this XpanDH webinar series has been a journey of knowledge, of insights, providing a platform for distinguished expertise that we have now here to share updates, case studies, and the best practice. And today I'm excited that will be no exception. So over the next hour, we will be the privilege to hear from the remarkable speakers we have with us that will promote a comprehensive understanding of challenges, benefits, alignment strategies, and supporting frameworks associated with collecting and using health data for a secondary purpose with the European health data space. Diverse perspectives also, management and research. So let's now take just a moment to introduce our first and distinguished speaker. And it's Professor André Peralta Santo. Good afternoon. And is Acting Deputy Director General of Health and Director General for Health Portugal. He's an invited professor of Nova University School of Public Health. He also holds a PhD from the University of Washington, USA, and a Master's Public Health from Nova University, and training in the epidemiology of Harvard Medical School. André is a trainee physician. He's a specialist in public health. He has dedicated his career to intersection between research and public health practice, and is passionate about data science and use to improve the health population. So I am sure today will enlighten us from a health management perspective. So Professor André, thank you very much for your presence, and the virtual floor is now yours. Thank you very much.
Thank you. It's a great pleasure to be here, and thank you for the invitation to share some thoughts about the European health data space. It's a real privilege. I will try to share my screen if that's possible, or to pass the slides if possible. Next slide, please. I don't think I have the ability to share my screen. If I do, I will share it. In the meanwhile, while these technical issues are moving forward, I can share some initial thoughts. So I'm currently the acting deputy director, but most of the reflections that I'm sharing with you are based on my academic hat at Nova University with a group of colleagues. We wrote a reflection paper that delved into the challenges and opportunities of the European health data space, and these are the main ideas that I will share today. I don't think I can share my slides yet. And this is a very exciting moment as a researcher and as an enthusiast of European health policies. There's a lot of action in Brussels, and I think we as healthcare managers and healthcare professionals should welcome that action, in a sense that creates a big opportunity for research, but not only for research, I think also for commercial purposes, although that's not the main scope of this session. But I think the European health data space will promote that commercial opportunities for many of European healthcare records companies, in a sense that will try to set a set of rules to make its interoperability easier between markets.
Well, thank you very much for your introduction, Professor André. We try to solve as quickly as possible this technical issue. That we are taking care of it, but it's your perspective. We are working on it. Yes, something.
Well, I can. So I can even give my presentation without slides. So I have just a few main thoughts to share with you and one or two strong ideas.
Okay, if you please, thank you very much, and sorry for this slight issue.
So should I be waiting for you to share my screens, or should I move forward without slides?
I think go ahead, please.
Okay.
And
I will go ahead. Yes, I will go ahead without slides. So the main big
thank you very much.
Idea. I had a beautiful picture to show you of the girl with pearl earrings, a famous painting from a Dutch painter, with a COVID mask. And that picture gives try to exemplify the power. Yes, that's it. That's my slide. Power of crisis to move forward European health policies. I know that many of you, as scholars of European health policy, know that this discussion about the European health data space was happening in Brussels already. My main point is that COVID-19 was a catalyst of these new policies, and I think it will continue to be a catalyst of new policies. And this European health data space, it's only a piece of a puzzle in new healthcare policies. Next slide, please. So as you might know, the European health data space is based on three core aspects: the primary use of data, the secondary use of data, and electronic health record system and wellness applications. The primary use of data will not be the focus of my talk, but I think it's worth mentioning that this primary use of data started already with the cross-border directive and the first few pieces of law and EU initiatives when it comes to health data. And this small picture that you have here, it's the vaccination digital certificate. And I think this is a great example that real access to healthcare data can happen and can happen fast. This, in the conjunction of all the European countries, was put in place in 3-4 months, I think. So this is an example of coordinated efforts between European countries, setting common rules and to make health data available. And I think if we were able to do this, we will be able to do more things like this one. Next slide, please. So my first main thoughts were very optimistic. Now, let me share some thoughts about challenges. The new European Health Data Space foresees a digital health authority. I think this authority is most welcomed, but there's a few thoughts that I think are essential to think of when it comes to the diversity of organizations of European countries. And the first one is to think about countries that have decentralized health systems. Portugal has a very centralized healthcare system, but other countries have a more decentralized healthcare systems. And how should the implementation of the policy, I think the slides are moving too fast. Maybe that's a hint that I'm moving too slow. I think it's worth mentioning how this digital authority will be organized, especially to make it harmonious between countries. A lot of things have been done already in sharing patient summaries, e-prescriptions. I think we just need to move that to scale, like we did with the vaccination certificates. Next slide, please. So this is what the proposal by the Commission says about the minimal set of data to be available: clinical data, medical devices, wearables, human genetic, genomic, and proteomic data, administrative data, including claims and reimbursements. It's a very wide range of data with different degrees of maturity between health systems. I think most health systems now in Europe have good administrative data, fairly good clinical data. All the other are path that we should walk in order to make this data more readily available about medical devices, about wearable, and also human genetic. I think it's good to be ambitious when it comes to the proposal. I think we should be somehow careful about the implementation, that this will take probably some years to fully implement and to have access to that data. Next slide, please. So you can see now that it's a challenge to the health system, and it's puzzling, but I think it's an exciting puzzle that we as a community of health professionals, managers, researchers will try to make sense of. Next slide, please. So this is a thing that I'm one of the things that I'm most concerned about. So I think the spirit of the law, it's to make data more readily available, not only to researchers, to the users, to the industry, to everyone. This article is somehow problematic, and we will delve into that, the problems that we can think of. And it says that any fees charged to data users pursuant to this article by the healthcare access bodies or data holders shall be transparent and proportionate to the cost of collecting and making electronic health data available for secondary use. So this is very broad and can have different interpretations. Next slide, please. And one of the main concerns is the uneven access to this data for secondary use. If we make it too discretionary, the fees to access the data. I know that mainly for private sector, and this is very important, that this European health data space thinks about the public as well as the private sector, but somehow we should be able to give some guidance of what is an acceptable fee to have access to the data. Another challenge to the public sector, it's the work that is needed to make this data available. We collect a lot of data, but data is not readily available to use for research purpose or to industry, or the industry to develop new products. And what I'm concerned about the public sector in general, that people might be overworked and underskilled to perform those tasks, and the time to respond to those requests might be a barrier to have access to the data. And in the private sector, the cost of accessing the data is a big concern, especially for the research groups. Next slide, please. So private and public providers, I mentioned here private, but can be public providers as well, might transfer more costs to the processing the data and make the data available. That is not within range of most researcher institutions to pay. And within the research communities nowadays, the funding process most of the times does not encompass the cost of accessing the data. This should be a flag for funding agencies and for research communities to make sure that when applying to funding, this is within their grants. And one of the concerns here, it's uneven access to the data if the fees are too high. And I think I made that point clear already. Next slide, please. I think we should be aware also that litigation. So when we really want to have access to the data, and the European health data space, it really grants the possibility to have access to this data. If the access is not readily available, I think we should think about ways that we will deal with litigation. Next slide. Another challenge, it's heterogeneous implementation in between countries. And I think the GDPR already showed this, that the same regulation could have different interpretations between countries and somehow make it easier for some countries to have access to this data and not so easy in other countries. And this is the next slide will be my last. So I think I've shared the opportunities that this new European health data space opens. to the research community, but also to the industry in having more access to data, to structured data that can be used to improve our knowledge of the health of the communities, of the effectiveness of drugs, but also to the private providers to train new algorithms that can be translated into medical devices. I think one aspect that we should be aware of is that's not only it's good to have a good legal framework to make this aspiration of improving the competitiveness of the European bloc when it comes to AI and health, and develop the health sector. Investment is needed, and we should be aware that a lot of money is being put into this health and AI space, and it should be this should be in mind of every country and the European Union to somehow make sure that the funding is available to develop those tools, not only that we have a good legal framework. And that's my last slide. Thank you for your time. And I hope I shared my enthusiasm about these new policies, the new avenues that it opens, but also some challenges that we have ahead. Thank you for your time.
Thank you, Professor André. It was a very enlightening presentation, and I think it will bring us a very good discussion at the end. Now, I think we'll go to Professor Nicholas Baumann. He holds the position of Executive Director of the Innovation of Health Initiative and is Director of ELIXIR, the European Infrastructure for Bioinformatics and Life Science Data, and will be sharing insights from a research perspective. Professor Nicholas, thank you. The floor is yours, please.
Thank you very much, Maria, and thanks to the project for giving me an opportunity to share some of our experience today. So could I have the next slide, please? So I'm not going to talk a lot about ELIXIR, which is the organizational lead. We are a research infrastructure, and our job really is to bring together national investments and national data centers across Europe and to sort of bring them into a single infrastructure where data can be managed and then also accessed and analyzed for researchers. And so we are anchored in the research. Yeah, if you could go back, I'll ask for the slide changes, please. Yeah. So we are very much anchored in the research space, where our job is to work with especially European research projects. Of course, all our national centers have a role in the national ecosystems and mostly form a coordinating entity for research data in the life sciences on a national basis. And so what we try to do together is, of course, to connect these national centers and make sure we can support European projects, but also then the large initiatives like the European partnerships or the missions. So next slide, please. And so increasingly, and I think that's why we're here today, is of course that a lot of data of great relevance and importance to research is not only generated within a research context, but it actually also generated within the healthcare system. So that's the whole secondary use of health data. And I'll give a few examples later in the presentation, but one important area for us is, of course, human genomics, and it's good to see the reference to genomics from Andre's presentation. And increasingly, of course, genomic data is being produced in the context of personalized medicine or sort of cancer treatments, or even in acute settings for rare diseases and diagnosis of children. And so then the question is, of course, how can we mobilize this data and bring it in to the research setting and make that available for research problems. So next slide or next build. And so that's really the problem, or the role of Elixir in this space, is to try to help our national centers to find ways of mobilizing this data and make it available for collaborative research projects. So next slide, please. And so when we do this, there are, of course, a number of challenges. And I think mine resonates quite well with the previous speaker, perhaps a bit more focused. But the key issue really is data mobilization. So how do we get data mobile? And by that, I think we use the word mobilization to really encompass all possible modes of access. It could be pooling data in a big hard drive at the central location, but it can also involve making the data accessible in situ. And increasingly, that's, of course, what we're trying to do. This needs to happen in quite a set of diverse organizations. Of course, medical centers, hospitals, public health laboratories, but there is also, of course, a lot of very relevant data for researchers being generated at that interface with healthcare, for instance, in large clinical trials or in research cohorts or within our biobanks. The key here is, of course, and I think this is driving a lot of the thinking and the architecture of this system, is really how do we maintain trust of citizens and patients. We often talk about data federations in Europe as a way of overcoming local regulation. I think fundamentally this is about trust. And so the individuals, whether they are volunteers participating in research or they are patients, they have a relationship with the local or regional or national healthcare system, and that will be different in different countries. But that relationship is really a relationship of trust. And so I think a big question for us when we start to look at how we can make the data power of Europe available for advanced research is really how do we do that while maintaining that trust of individuals in their local institutions. And I only need to look at my own family members. We all have aging parents or relatives, and they don't always make the distinction between a treatment or when they participate in a clinical trial as a volunteer. For them, it's a relationship with their doctors or their healthcare system, and they, in a way, hand over their data. And so I think in any approach that we take, we need to think about how we maintain that trust. And I think that really is the driver for these European federations, because then we maintain the relationships with the individuals. And as the previous speaker pointed out, there is a lot of need for training and capacity building within the institutions. If we don't have the right people, the right skills, and the right capabilities, then neither the regulation nor the technology is going to bring us forward. And so I'll share some of the experience from Elixir in that respect. So next slide, please. So a lot of what I'll talk about in this very short intervention is from a large flagship project that we are leading, which is called the European Genomic Data Infrastructure. It's related to the data spaces and the health data space. And I think it's in many ways, it's a forerunner to really establish a sort of early example of how data can be shared and accessed across national borders. It's building on a commitment from a number of countries in what's known as the 1 Million Genome Declaration. And I think the importance of that declaration, which is a political commitment, is really that there is a high-level policy commitment from the countries to make data available in what we've called a shared framework of trust and infrastructure to safely access and integrate genomic and the connected health data across the borders. Today's webinar is for XpanDH, and of course, so I highlighted, there are many aspects of making this working, but I highlighted the important role of standards here. And so, and I think that the important part is to decide to which level you want to standardize. And in the case of the genomic data infrastructure, the standardization is really at the interface level. How do you connect data across the countries, and what is happening inside the countries is very much subsidiarity and something that each country or region or institution will manage themselves. I'm not going to talk a great deal about it, but I think it's important to think about what we call maturity models, but that's how you build a whole framework of competences in an institutions. It's not enough to have the technical skills. You need also to have the organizational capabilities. If you have a technical endpoint for sharing data, that has no value if there is no organizational readiness to write data access agreements and to or let researchers look at the data within a trusted research environment. So next slide, please. And so within the 1 million genomes, or the genomic data infrastructure, this is captured in what is called the framework, or the trust framework. And so that's really guidance for all the participants on how you can get the solutions implemented in national and local organizations. And that cover all the aspects, including ELSI, but also training and organizational capabilities. So it's really about supporting that standards-based federation at the very local level. And I think that's critical to success. And the first sort of big milestone of the project was earlier this summer, when the first version of both the framework and it's known as the starter kit has been rolled out. Next slide, please. And so I thought I would end with just one example, and this is shifting slightly from genomics, but I think it's a great illustration of the need for making quite a large diversity of data available in the data spaces. These are two recent papers from Denmark, from Søren Brunak's group in Denmark. Denmark has a very advanced system for capturing most of the health data in the country. And actually what they've used is the claims data. So for those who are a bit technical, the papers are using ICD codes and essentially looking at what they call disease trajectories, which is the sequence of diagnosis within the healthcare system. And it turns out, and I think without going into the science, which is really interesting, so do read the papers, but I think there's a couple of other learnings from these two recent papers. And the first is that you can get surprisingly deep biological insights from actually administrative healthcare data. So I think that's what we see from these papers. So, and that then spawns a second round of research, which are using more molecular data. So I think that's the first learning. I think the second learning from these two papers, so both of them did a deep study within the Danish data sets, and then they sought out international collaborations to validate those findings in completely different cohorts and patient demographies. And so they could get an understanding of transferability of these data sets. And I guess that's really the plea here, because the validation happened in the US cohort of Veteran Affairs and in the UK Biobank. And I think this shows the importance of getting cohorts of diverse data sets ready within each country to participate in large-scale international collaborations. And so I guess that is really the driver now for the European health data space and the national implementations, is to make sure that we build up this capacity in most European countries, because otherwise it'd be very difficult to participate in research projects such as these. So next slide, please, and I'll try to wrap up so I think the key points that I wanted to get across is really the importance of finding and accessing large data sets from diverse settings, both for validation, but also to deal with things like robustness or bias in AI. And that biological and health insights can come from quite unexpected sources, including administrative data. It's important to maintain the trust of the citizens and the patients. So that's really, I think, the core argument for a federation and connecting to local institutions. And for Europe to be successful, I think, to drive this collaboration, we need to build capacity for federation through through national systems using dependable international standards. And once you have done that, I think the added benefit is resilience. And so by having a diverse distributed system, it also becomes quite resilient. So thank you very much. I'll stop there.
Well, thank you very much, Professor Niklas, for the engaging presentation from a research perspective. And I think our discussion will be very, very interesting. So we were in a genuinely informative and exciting sessions with these honorable speakers, with the two diverse viewpoints. But before we go on to our discussion, I would like to express our heartfelt gratitude to Professor Niklas, Professor André, and for sharing their invaluable perspectives with us today. Thank you very much. So your presentations and expertise have set stage for what promises to be an engaging and very well discussion. So, oh, I'm sorry, Dr. Andres. I'm sorry for I was starting the debate, and you are speaking next. Very sorry. Thank you, Professor. Sorry for my mistake, Dr. Andres. We will hear you now, and from a policy perspective, and the principal scientific advisor from the GSAT European Commission. Thank you so much, and let us hear you, please. And sorry for my mistake again. Thank you.
Thank you very much, and sorry to jump this way, because unfortunately I got a emergency news from my home. My dad is in very bad state, so in the hospital, so I have to travel. Urgent. So I am in the bar in Cambridge, so sorry about the background noise. But catching my train to the airport. Just a few observations which I promise to share as a part of my journey with these important regulations, which I was also kind of co-author with my team, and I would like also to refer to both Andreas and Niklas' presentation, because I think it's important to say this legislation, I fully agree with Andreas, was born somehow thanks to COVID, thanks to COVID, in the sense that it was very painful lessons for many of us, how difficult it was to gather evidence quickly, right quality, and also make wise decision because of lack of evidence or blurry evidence at the time of decision making. It was on the hospital level, it was on the clinical units level, but also of course was difficult on the European level, even globally. So this also showed how badly we need accurate and a high quality data, but also in the right time. So it is important to remind us these lessons, because my feeling after all these months this year is that the lessons learned from pandemics are vanishing much quicker than we even are able to kind of digest them. The second point is I am now working together with EIT Health, European Institute of Technology Health team, kind of going around different European member states and trying to understand better what are the potential issues related to implementation of the regulation. As Andreas said, the negotiation is still regulation is still under negotiation, so we don't have the full picture what will be the final design of the system, but for sure it's revolutionary change we are proposing, and hopefully when agreed, and because this is what Parliament and Council are aiming, we hope to get the setup which we have to implement. But of course, the implementation is depending on a number of issues. But but trust, I would like to refer to Niklas' point, is a key word. And I hope you agree, I mean, speaking to participants, that long vision is there, but without kind of commitment to the nitty-gritty, arrangement, which often they're on hospital level, management level, on the professional approach, we will not get to the stage when we will be able to use data as we would like to see them. And the last point, and I will conclude in this stage, is that this dependency of different puzzles, if something is going to work or not, it's very important, because in one hand, in the implementation, as you know, from change management process, in one hand, of course, we need this push. Building commitments is often more difficult than building the right kind of regulatory framework. But at the same time, we need feedback. We need constant, what work, what doesn't work, and sharing our experience. So I hope we'll continue. And of course, implementation of the standards, improving the quality of the primary health data, which I think the project is also about, which we try to standardize, we try to use across member states. It will help, but again, train people, but making them believe this makes sense, building the culture of data. This is the critical one we hope to gain, in next years to come. Long journey, revolutionary approach, but I'm sure that everybody will be happy to get out of this kind of system, as many good fruits as possible. Thank you.
So thank you very much, Professor Andrea. Thank you so much for your availability being with us today. Thank you so much for your effort. And thank you again for all the speakers and the presentations. And we'll have an engaged discussion. So in this discussion, I think we heard some words like data, tasks, financial, time, trust. That's the words that were in my mind: patients, citizens, regulation, capacity, legal issues, interpretation, training, organization, resilience, standards. And it puts my mind bubbling. Sorry for the term. So I have here one question I would like to address from the audience for starting our debate. Question to Professor Niklas. Thank you again for the presentation. And the question I have here is some Danish data is only be available to Danish citizens. Is the Danish dataset that you presented available to the EU researchers?
So I wasn't involved in the research of those papers, and I don't think I can really answer for the Danish Public Health Authority and their data access procedures. I believe the question is correct. I think some of the data is only available in Denmark. Some of it is possibly available broader. But I guess this is the question is really cuts to the point of the European health data space. So I'm sure Andrej and Andrea would like to comment on this, because I think the point I was trying to make is that those data sets, and it doesn't need to be molecular data, can be really very valuable to drive biological insights, but also healthcare improvements. And so, of course, we would want to make sure that they are available as broadly as possible. But I think for the details on the access to these particular data sets, I think it's better to look at the Public Health Denmark pages.
So, Professor Andrea, if you please comment.
Yeah, well, thank you. Yeah, first it was very good for me and a good learning experience to see the presentations of my colleagues, Nicholas and NJ. And thank you for sharing your thoughts. And thank you to the work done by the European Commission and the NJ team. And I know that's a lot of work done drafting a proposal of regulation, and we hope that next year we will have a new regulation that somehow provides the railroads of how we should share information and data. And about that discussion about what are the railroads, I would like to share some thoughts. I think initiatives like Elixir that I was not aware of are fundamental. So somehow a collaborative effort that creates capacity building within countries and between countries in leveraging the existing data. And I think probably we should invest more in initiatives like this, and we should not underestimate the need for capacity building. We can have the best legal framework without investment in capacity building, not much will happen. And I can share some experiences. So during COVID, we have done a lot of collaborative work with the national agencies and colleagues from Denmark, the UK, Luxembourg. And what we have, I think the lessons learned is that if the teams already know each other, the procedures are in place, usually research can happen at a pace where we will have real evidence for an emerging threat. If that is not the case, research will take more time, and we will need to establish those railroads. I think it's an important discussion if we think that we will be able to move data from one place to another, so move data from Denmark to France to be analyzed, or we should have a more federated approach where we share the recipes for analyzing data, and then we look at the results. I have not formed the final opinion on this, but I think this is part of the implementation discussion that we already mentioned. Thank you.
So maybe, Eva, Maria, I think I would like to add here, something which maybe Nicholas can also complement concerning the. Do you hear me?
Too, please. Thank you.
Do you hear me now?
Yes, I can hear you well.
Okay, sorry. Sorry, I think it's important to say that in the preparation of the implementation, we also triggered the special project which is preparing the kind of checking how the cross-border exchange of data may work, and there are 5 so-called use cases agreed to be checked, and one of them is linked to the COVID and antimicrobial resistance. Other is also something called the vaccines, to European medicine agencies, and each one has the leading institution, and Elixir is also responsible coordinating one of those implementing kind of use case, which maybe Nicholas can say a few words, how this is going on. But the idea is to really check, in the real kind of term conditions, how the exchange of cross-border data may work or may not work, at least in this current stage of affair. So this is I think for the participant also good to follow this so-called pilot European Data Space project, which is financed by a health program. But I think it's maybe Nicholas, you can say a few words, how this works in practice. Thank you.
Thank you for your comments. Well, I don't know if you have three of us, Professor Andrea, Professor Nicholas, and Professor Andre Reis also. If you have any question, would you like to put to each other from since you have a different perspective here from the point of view of the European Alphabet Format Exchange? Professor Nicholas, do you have some curiosity you'd like to address to Professor Andre? Or Professor Andreas, you have some curiosity we'd like to enlighten with Professor Nicholas?
Yeah, so
since we have different perspectives, different point of views, different discussions here, different backgrounds.
Yeah, so I'd like to pick up on Andre Reich's question on the EHDS pilot. And I think that also touches on the mentioning of TEDAS in one of the open questions in the Q&A. And I guess that's exactly what we're trying to do. I mean, Elixir as an organization, we're anchored in the research space. We have a strong focus on genomics. And so that's a community, both in the clinical space, but especially in the research space that we are well linked with. And so what we are trying to do is to bring those experiences and that knowledge into the broader discussion on EHDS2. And I guess that's very much what we're trying to, without going into the technical detail of the pilot use case. But I think that's really what we're trying to do, is to work within that project to test our technologies against the emerging developments in the European health data space, and also learn from colleagues that are working in other fields. So, I mean, there are many different types of data, many different research communities that are coming together with the public health systems. And I guess that might be something I'd be very curious from Professor Peralta and Santos from Portugal, is really how the health system looks at the research projects and how we better transfer some of our knowledge into the health systems.
If I may, if our moderator helps me. Well, I think we need some good examples to push all the research community and to align our expectations. And I think the 1 million genome projects, it's one of those flagship projects that Portugal is participating, and I'm not directly involved, but I'm very excited about this project that I think has the ambition. It's very ambitious, and I think it's what we need to prove that this can work. So our ambition to create a common European health data space, these flagship projects, I think, are fundamental in the first years of the implementation of this new regulation, to make sure that this is possible. A lot of challenges remain when it comes to national research infrastructure. One of those are to somehow link all the other pieces of data that we have, the genomic data, the proteomic data, the wearables data. But I think we are putting the right pieces on the right place. So first, make sure that the genomic data have the same standards, is readily shareable between countries. And hopefully in a few years, maybe half a decade or so, that we are in a position where we have all the pieces of the puzzle together. And I think that will be truly revolutionary, in a sense that we'll have an enormous amount of information where we can leverage new algorithms and new methodologies to improve our knowledge of population health outcomes. I would also like to stress one of my last ideas, it's very important to have a new regulation, but this needs to be accompanied with investment in science. And I think the EU healthcare projects are, it's a system of financing these projects. But I truly think that if Europe wants to be competitive with the US and China, we need to put more money where our ambition is.
Thank you very much, Mr. André. So we are just finished. We have 3 minutes left for my Portugal time here in my computer. So thank you very much. I will just make a few reflections, closing remarks, if you allow me to. Thank you again for your perspectives and your ideas. And I think today I will go home with more information and more I don't think it's smart the term in English. It's another term, but more happy and exciting with all this discussion. So I want to extend our heartfelt thanks to our 3 distinguished panel of speakers. Your insights were very empowerment for the discussion today. Thank you very much. I'm an optimist for nature. I look always of a bright side and a positive side for all these debates and questions and issues that we've talked and challenges. So I think in the last hour, we have the privilege of listening the 3 perspectives to reflect upon this discussion of the health data European space, the challenges and the benefits we have all from the front, and are we going to harmonize and to align this use of the primary and secondary data that we have? We have a lot of data in the hospitals, so we have to harmonize and try to quickly go forward. So I think we are going to encounter a few obstacles. But I also think that we must have all together this journey with a shared goal. So I think in the end, all the efforts will lead us to success, and because our healthcare ecosystem is global, it's not national, it's not European. I think we have to step forward to a global-wide European ecosystem healthcare. So thank you very much again for all your availability and to share your perspectives with us. Anderson, thank you.
Thank you, Maria. Thank you, the speakers, for the presentation and this webinar in the XpanDH. Thank you so much, and apologize for the technical errors that you had. And also, I would like to announce the next webinar from the XpanDH project that will be about the risks of the European health data space approved sooner rather than later. So this next webinar, you can also scan the QR code to do the registration for the next one. Will be on Wednesday, 8th of November of this year. So this is the last message, and also please, this is the link tree from the Expand the social media and website. Follow us for more next news and also webinars. Thank you so much, Maria, for moderating this webinar. It was a pleasure to have you here, and also for all the speakers. Thank you so much, and would like to see you again in the next webinar from XpanDH. So bye-bye, have a great day.